I think divisions and a GP for Me initiative has changed over this past 4 years, has changed our community just incredibly. It is just vastly different now than it was 4 years ago. We now have a community of family physicians that are completely engaged as part of the solution for primary care in their community. We have, patients can now get access to primary care for the most part when they need it. And not only that, they have access to their family physician, but they also are now getting access to a whole team of providers along with their family physician if they need that, so that all of their care needs can be taken care of through the primary care home. And we can only hope that as we go forward with this kind of model of care, that health outcomes for patients, for people who live in Prince George, will be vastly improved.
For me, the fundamental achievement of the division has been to develop the trust with all the physicians in town and the trust with the health authority that we, an organization that can be depended upon. Primary care in our community is changing and hopefully will continue to change for a long time to come. And I think the primary change is that physicians are feeling connected to something that they're not sure exactly what it is, but they know it's something better than what was there before, which was working away in their offices, totally isolated without much support for them or their patients. That it was very disjointed support, and now they feel that there is hope that things will be better coordinated and life will improve for them and their patients. The GP for Me initiative certainly helped. We had been thinking about these things for a few years before divisions came about. When the GP for Me initiative was announced, we were ready to take that funding and do something with it, as we had quite a well-developed plan for how we wanted to move primary care forward in the community.
During the GP for Me prototype, we achieved substantial work in 4 specific areas. One was in team-based care. We knew that we had, a group of vulnerable people in our community who needed something different than what they would be getting in their physician's office. They needed team-based care. So we began to look at things that would address their needs. We built a multidisciplinary clinic, for instance, in the first 2 years of our initiative. And we also knew that we needed a few additional doctors in our community. We didn't have enough family physicians, so we started to focus on recruitment and retention. We partnered with others who had the responsibility for recruitment, like the health authority, and brought the community into that work as well. And we also knew that we needed to begin now to start working upstream, doing some preventative work and engaging our community to try and reduce demand by helping our community be healthier.